Let's stay with that news that Pfizer is 90% effective in its new vaccine, stunning scientists, even Dr. Fauci, saying it will have a, quote, major impact on everything that we do going forward. Let's now bring in Bloomberg News health editor Drew Armstrong, who's in New York, to help us dig into the science of this breakthrough. Drew, it's great to have you on the show today. Give us an idea of what this means for the end game of developing a vaccine.
Well, I mean, this is, frankly, probably the best news that we've gotten in months. I hope I'm not being hyperbolic by saying that. But, if you look at the history of this pandemic, we have really been on the back foot against this virus for, since January when it began. And finally, you have an advance that shows the quite promising potential to turn the tide on that. 90% efficacy basically means that for every 10 people who would have been infected, 9 would not be. And if you think about how viral pandemics happen, they need hosts that are vulnerable, and a vaccine stops that. Assuming that these data carry out when we get the details of being as effective as they appear to be based on the top line, which is just coming in a press release, and assuming that they are safe, this is about as good a news as you can possibly hope for. It's pretty remarkable.
Drew, I want to ask you what we've heard from leaders around the world. President Trump tweeted about this earlier today. Vice President Biden just wrapped up earlier today speaking on this. He said that he's going to follow the science and he's going to adjust to new data. And then in the UK, Boris Johnson saying that the UK will be ready to use Pfizer vaccine when it's approved. What is the task that these world leaders have ahead in convincing their citizens to actually use a vaccine when it becomes available?
I think the actual harder thing that world leaders are going to have to deal with is convincing people to continue with some of the public health measures like social distancing and mask wearing until a vaccine is available. Just because there is what appears to be an effective shot sitting in Pfizer's labs doesn't mean that anything has changed out in the real world. And we are in a really, really ugly period right now of this virus. In the U.S., certainly, cases are hitting new record highs every single day. We've had close to 6,500 people who have died of this virus in the last week, and none of that has changed, and in fact is getting worse right now. We're heading toward winter when it appears that the trends on this are not good. So I think the real challenge that world leaders are going to have, in addition to obtaining this vaccine eventually when they're able to get it, which is likely going to be next year, is going to be convincing people that they need to keep taking the same precautions that they have been, because this thing is still out there, it's still dangerous, and the circumstances on the ground. As good as this news is today, the circumstances out there for folks who are, walking around, planning Thanksgiving, planning Christmas, none of that's changed.
Yeah, exactly, because this is not going to happen anytime soon. So just give us an idea of timeline here. I mean, what did we used to have to, in terms of time, have to wait to get a vaccine like this? And how has the timeline shifted with this time around?
So the good news is that the timeline in terms of getting this is very much accelerated. The U.S. government and other governments have been striking deals to essentially pre-purchase a lot of these vaccines before knowing if they'll work. The U.S. has a deal for as many as 600 million doses. They've guaranteed 100 million dose purchase. So that means that companies that are making these vaccines, and it's not just going to be the Pfizer vaccine. There's good news for everybody. I should emphasize.
Yeah.
Have been producing these kind of at risk, so it's going to accelerate the timeline. That said, certainly in the U.S., the caution from top health officials has been that for most people, you are not going to be getting a vaccine until sometime next year. People who are at the front lines of healthcare, who are facing this virus really, every day when they go to work, other frontline workers who are in particular areas of exposure, I think basically people who have to be out working and interacting with folks, and then highly vulnerable people, people with a lot of pre-existing conditions and nursing homes. Those are the people who are likely to get this first. A healthy 39-year-old, am probably pretty far down the list in terms of access to this thing. And most health officials have been cautioning this is going to be sometime in the spring or the summer at least before there's enough availability of this vaccine to do broad population-wide inoculation.
Yeah, Drew, I can't thank you enough for that message that despite this news today, nothing has changed for us for Thanksgiving, for Christmas. We need to exercise caution as we continue to see record case numbers. Bloomberg's Drew Armstrong reporting from Hudson, New York. Thanks so much for your time, Drew.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.